Hello, listeners. This episode is part 2 of our interview with Dr. Nana Bhalla about her long career practicing all over the world with Médecins Sans Frontières, or Doctors Without Borders in English. If you've not listened to part 1 yet, which is the prior episode, I strongly encourage you to do that first. We pick up now with our discussion of what it means and what it takes to be good at the practice of international medicine. I wanted to explore a little bit more this idea of being good at this, going overseas to these various projects. And I want to know if you could elaborate on that. And I know you tend to be very modest. You know, you're always somebody who's like, oh, I'm not that interesting and I don't have much to say. But the truth is, there just aren't a lot of people who do this kind of work as much as you have and in as many places. So like it or not, you have something to say. And so I'm wondering if you can just set aside your modesty for a minute and just be honest about what it is to be good at this.
I feel like I can go to a mission and I can listen to other people, either from MSF, from the headquarters, from my boss, telling me what I should be doing, what my goals and objectives are. But then I also try and kind of hit a pause button at the beginning, like I said, and try and observe and get to know the activity myself and see it for myself to kind of also understand where I'm working. And I think that when I say that I'm good at it, I think that what I'm trying to say is that I'm able to look at a project now on a transversal kind of perspective, not just as a clinician and a doctor now, but I can do the daily rounds with the team and identify things just from observing, not participating, from quality of nursing care to problems in documentation, to seeing issues with hygiene during the visit, to gaps in our project in terms of decision making, in terms of complicated cases. So I feel like I've learned to be able to step back, listen to everybody, but also listen to the people that are the patients and the staff, and find a way to accomplish the goals. Or if I feel like maybe the objectives that were given to me are not really the priorities or objectives, but I find other things that need to be done before I can hit those objectives. Because I feel like at the end of the day, whatever objectives I'm trying to obtain are always going to be for the same, to accomplish 3 things, not just what I want, and not just what MSF wants, but also what is going to make work easier and better for the staff, and what is going to make the outcome better for the patient. And so I kind of go into every mission with those 3 things in mind and try and make sure that whatever I'm working on or implementing with the medical team is trying to address all of those things, not just one of them.
What you're describing is a kind of mastery that comes with having done it for many, many years, this capacity to understand the entire system and look at it from many levels at the same time and put it all together. What do you think is the difference between the physicians like yourself who keep on coming back, who find this rewarding and meaningful, and those who thought they wanted to do it and then just don't return?
I think it can be very many different things. I think some of it is just simply financial burdens a lot of the time. If you're a physician in the United States, you probably have at least one set of loans for medical school, if not 2, including undergraduate. I was lucky to not have any loans from undergraduate, but from medical school. But I think that, it's some of it is financial burdens, your personal life. You start after you spend 10 years studying to be a doctor, at that point you want to start a family, you want to get settled down. So doing missions like this can be difficult if you want to start a family and raise a family. If it's strictly professional, I think it can be, either they had a bad experience and maybe it was just the experience that was bad, but it was bad enough that they don't want to give it another try. I think some people have a difficult time with the personal limitations that you can have. There's a lot of rules with MSF, security rules. So there can be a lot of rules. And you can't live your life necessarily the way that you want to live your life. And you don't have all of the freedoms available to you. You have somebody who's helping to take care of you. So there's people cooking for you and people cleaning so that you can focus on your work and you're only there for work. But some people have a difficult time with living in those conditions. And, I think one mission I lived in a tent for 4 months. And I think some people it's a little bit too limiting in terms of their personal liberties to do that type of thing. But if not, and it's the professional, then I think it's, usually because of potentially a negative experience based on either your mindset. I know a lot of people that have personal problems and they end up doing work like this because they feel like it might help with some other problems that they have in their life. But I think it's what people's different expectations are going into a mission or going into this work. If it's strictly personal or professional, then probably it has to do with what people expect this is supposed to be like and what they're supposed to get out of it. And I think for me, it's usually I get something out of it because I learn something every time. But my purpose for being there is not for me. The purpose of me being there is, for the population, for the hospital. It's for them. It's not for me. And I think if you can go into it with that type of attitude, I think you can have a lot less frustrations with expectations.
Yeah, I think that's an incredibly helpful point. As you said, some people might romanticize it and think that they can run away from their problems, but the problems just go with them.
Yeah.
And I think that's your point. And if you're going there because you're hoping that it's going to do something for yourself, you may be disappointed. But if you're going there because you'd like to be helpful and make a difference to a particular project or mission, then that's pretty concrete and potentially tangible. I want to ask I guess maybe a kind of obvious question, but still interested in just trying to get your thought on it, is just trying to understand the difference between working in terms of the personal meaning for you when you compare working in a place where you're sent by Médecins Sans Frontières compared to just being a hospitalist in California. So, if you think about it, in both cases, you're taking care of sick people. In both cases, you're in a hospital. In both cases, you're doing a lot of good work. Obviously, if you're at a hospital in the United States, you're still going to be interested in the larger issues of, quality of care and the management of the team and all the kinds of things we deal with as physicians in the United States. And of course, it's a lot more comfortable here. You get to go home to your nice apartment. Obviously, not counting the pandemic, you can go out to restaurants, you can see friends, you can see your family. So you're obviously giving up a great deal when you go to Haiti or Ethiopia or any of these places. What is it specifically that draws you to this work? What is it that you're getting specifically from doing this work that you're not getting from doing it in the States?
It's always different. So it's hard to say. I think that when I started doing this kind of work, I thought that I would do it for a little while and I kept on saying, you have to pick a path. You have to either go in one direction and you're just going to dedicate yourself to MSF, or you're going to stay in the States and find other things, other volunteer work to make yourself feel a little bit more fulfilled and more meaningful. But every time I ended a mission and after a couple of months, I start to get that itch wanting to go back out on mission again. And I think that for me, when I go on these missions, specifically what I gain from them, or it's different every time. I think for me, I enjoy the challenge of it. It's never the same place. It's not always the same problems, not always the same type of project or diseases. So I'm always learning something, whether it's on a operational project management level or whether it's on a clinical level. So I think it's the fact that medicine is so boundless, from, the practice of medicine and being a clinician to just the importance of clean water and what kind of effect that can have on a community or a flood or the malaria season, any of these things, the effect that it can have on a population or on a country or in a community. I think putting myself in those situations with the experience that I have with MSF, it's interesting to put myself out of my comfort zone, to feel challenged a little bit, to feel like I can accomplish something. And in every mission, I've learned something. And that's one sense of growth. To me, it's a lot more interesting than reading a journal article. So
And what about, you mentioned that you hope to do a lot more of this in the years and decades to come. Can you just say a little bit about what your dreams are in the next 10, 15, 20 years? Do you hope to be able to do this full time? I know, of course, there's the money issue. You need to obviously save for your retirement, but it sounds like you're looking forward to doing a lot more of these trips.
Yeah. I don't know. I have to also say that I do enjoy coming back here to the States because it's nice after, coming back from this recent mission. I worked as a medical team leader. It was a surgical mission, a trauma hospital. There was, over 300 national medical staff. I was managing more than 13 or close to 13 expatriate medical staff. And it's nice to come back and just be a doctor. It's nice to come back and still be a doctor and have that relationship directly with the patient and their families. So it's kind of the best of both worlds because, I'm not really a clinician on a daily basis with MSF anymore just because of my experience, but I still get to feel fulfilled there, but I still also really enjoy coming back to the States and being able to just work as a doctor again. In terms of the future, it's hard to say. I can sometimes guess what I'm going to be doing next year, but I have never been able to say what I'm going to be doing anywhere plus 2+ years from where I am. I have no idea where I'm going to be living, where I'm going to be working, what I'm going to be doing. So it's difficult to say. I do think that probably as I get older and as I probably won't be able to run around the hospital anymore as a hospitalist, I do see myself kind of making more of a transition to medical administration, either with MSF or in some type of role in global health.
Sure. Now, can you say just a little bit about COVID in terms of your most recent trip? Obviously, the pandemic would have been an issue in Haiti, which was where you just got back. Can you just say a little bit about the experience of having the mission during the pandemic?
I think the COVID there has been pretty well contained, surprisingly, considering their neighbor, Dominican Republic, has been doing a little bit worse. There is still fear. The numbers were going up when I left just a few weeks ago. The Ministry of Health is still running the main COVID units in Port-au-Prince. We obviously had to take a bunch of precautions in the project, especially being a surgical project, in terms of rules and patients, cutting off visitors like hospitals here in the States. And all of that, especially when you're working and living in a context that's already difficult, just adds another layer. It becomes part of your daily life, but I think it's just an extra layer of uncertainty for the staff that are Haitian, that are from Port-au-Prince, that live there. They're already dealing with significant economic decline, significant security concerns, significant political unrest. And so this on top of everything else, it's not just COVID. It was also having to kind of battle on days protests were happening, which blocked all of the public transportation. There was kidnappings of civilians and of physicians in Port-au-Prince by certain gangs to try and deal with the economic situation to get money. And everybody would just continue to come to work. And once you get in the hospital, you put your mask on and everybody just goes to work and you're just there for work. There was a big gap of about 6 months where the expatriate team, because of the pandemic, closing down the borders and flights from March until July, September, where the national staff basically helped keep the hospital going and running with a very skeleton expatriate crew. I think when I was there, we were the first full medical team after the pandemic to restart.
Now, you talked about kidnappings of physicians and so forth. Médecins Sans Frontières has a reputation for going wherever there's a need, even if there's some risk. Has it felt dangerous at times? How much danger is there? How much risk is there for some of these projects?
You always get a briefing and a risk assessment when you're proposed a mission. And you can ask or they give you further information, and you can always say no to the mission if you don't feel like it's something that you're comfortable with from a security standpoint. And I've had everything from being able to move freely and go for a run in the morning every day to not being able to walk at all and having the hospital be less than 500 meters from where you live, but you still have to get in a car to go there. And so there are different levels of security rules. It can be liquid, it can flux through your mission. It can start off having a lot of liberties to having really no liberties or being able to move around. So there's always a risk assessment. You're always discussed security, especially particular types of missions, and what you're able to do, where you're able to go, and that kind of thing is always affected by the context that you're working in. And you have to abide by those laws in order to do the work and stay in the team. But I've never felt unsafe. I've never been in a position, or I've never felt like I was unsafe, or, the security rules were too lax or were too strong. I just follow what they tell me to follow.
Mm-hmm.
I think the only times that it's difficult to accept in the medical field is when it affects your transfers and when it affects movement of patients. That can be frustrating because when you have a patient that's critical and for whatever reason, there's just a general rule that you don't transfer at nighttime, even though there's no reason specifically to have that rule. Nothing's ever happened. I have a couple of memories of being very frustrated when there was a patient that I wanted to transfer and then we couldn't transfer at nighttime because of security.
Mm-hmm. Yeah. Now, for young physicians who are thinking of doing MSF or something comparable, how difficult is it to get a job like the one you have in the States where you're given the kind of flexibility that you've negotiated to be able to go on these trips?
It's very difficult. I think I kind of bounced around doing a whole lot of different things when I first started doing MSF. And I would end a mission, and usually their healthcare MSF would cover you for an additional 3 months. So sometimes I would just take a break for 3 months and travel or just relax and then go straight back out on mission because it was easier than trying to find a job again. But I knew I had to work in the States in order to continue to keep up my clinical skills. And I think in the beginning, it was fine because I was able to find work through some contacts that I had in Chicago when I was coming back from missions. I think when I decided to leave Chicago and come out to California in between missions, it was a little bit more difficult because people are interested. People are very interested and think it's very interesting that you do Doctors Without Borders and this type of work. But a lot of the time when they hear that you haven't worked in the States in a year or a year and a half, it's not that interesting to them anymore. So I did local TENMS work at the beginning here in California when I started working out here, kind of floated around doing some inpatient and outpatient medicine, which was fine in terms of being able to make money, but just also didn't seem very fulfilling and didn't really feel like I was enjoying myself very much. So this group I actually joined, I actually quit them twice to go on missions. And every time I come back, it always just works out that they need somebody when I'm coming back from a mission. And so for the past 3 years, I've been able to negotiate, but it's because we're a private group that has a contract with the hospital, but we're a private group that basically run ourselves. And I've been lucky enough to find a group of people that respect what I do. So they're able to, we're able to find a way for me to maneuver and negotiate my time here working with them, but also trying to find some time to do mission work as well.
Sure. Now, as you're probably aware, burnout is a crisis in healthcare today. It's been estimated that 50% of physicians, based on surveys, that 50% of physicians meet the criteria of burnout, of being professionally burned out. To what extent does this work for you and the missions that you do, the trips you do for MSF, sustain you?
I think that both the work I do here right now in the States and the work I do with MSF, both of them sustain me. Here allows me to have a sense of familiarity and comfort and still have that direct contact of being with the patient and being a doctor. But I think MSF kind of just the challenge of it, being put in a different context, being out of my comfort zone, different objectives, different things to tackle, different environments and different challenges. Yeah, like I said before, usually after a couple of months of working in the States, I can come back from a mission and I will be completely exhausted. But after a couple of months, usually after 2 or 3 months, I'm already starting to think of my next mission and where I want to go and when I can go. And so I think it's both of those things, the familiarity and the comfort of my work here and the work that I do with MSF just keeps the spark going, you know?
Yeah, it almost seems like it's the right arrangement for you, just actually having both of these.
Yeah, for the time being, for sure. That's what I need. I think that some of the things I would like to do with MSF would require that I'm more available to them for longer periods of time. So I think at some point it might become a decision of one or the other and when.
Sure. It sounds like as you get a little older, you may find that you want to spend more time doing work for MSF and perhaps more time in a management role over there.
Yeah.
On this most recent trip, you actually had supervision for, I think you said, several hundred people.
National staff. Yeah.
Yeah, so it's already a lot of responsibility, and then you're coming back here basically to, as you said, to be a doctor like the rest of us. I think we've really given a picture for young physicians, listeners, about this particular type of career. You know, when as a program director, I used to see it was almost like every fourth personal statement from a medical student was, you know, I want to go work in international health. I want to go do missions, et cetera, et cetera. I did something when I was in college. I did something in medical school. And yet very few people actually end up, I mean, a small number of people do a mission or two while they're a resident. And then maybe an even smaller number do maybe one when they're an attending. But the number who actually end up making it a sustained part of their professional career seems to me to be really quite small. Do you know others who have followed your trajectory and actually continue to do this work throughout their professional career?
I've met a few Americans, but it's more either people who dedicate many years or consecutive years to MSF at the beginning of their career, or join MSF and dedicate towards the end when they're closer to retirement, towards the end of their career. I haven't met a lot of medical people that kind of do the same thing as I do, and they're still clinicians, but try and have a regular routine of doing missions in between.
Right, right. It sounds like there's a huge pay cut if you go full-time MSF. It would be hard to pay medical school debt. You really need to be working in this country and going back and forth the way you have. Is that right?
Yeah. I think once you start having some experience with MSF, especially if you start working at a headquarters level, then it's more comfortable. And I think the salary is a little bit more, it's obviously not equivalent to being a physician, but the salary is a little bit more rewarding when you work in a higher level headquarters. Mm-hmm. I generally still am somebody that I always want to be on the field. So if they offer me a position, they've offered me positions working in coordination, which is usually being in another country, but you're working more as a referent, not directly involved in the project on a daily basis, but giving medical support to the team. And that's something that I still am avoiding because I think part of it is also for me, it's not rising up in the ladder of the professionalism of MSF, but it's the jobs and the posts that I enjoy the most. And I think for the time being, I'm always going to choose to be in the field above anything else. And that you make a better living, you have a better paycheck the more time that you spend with MSF, but it doesn't compare to what I might be earning in the States as a physician.
I think it's really, in many ways, sums it all up here because the message, I think, really is you're an example of somebody who's kind of found the right recipe for the life you want to lead as a physician. It involves working in the United States, providing direct patient care, having all of this learning opportunity and experience, working in a variety of MSF settings. You've been intentionally insistent on not rising up the hierarchy at MSF. You've wanted to be somebody who's on the front lines and who doesn't end up just being in headquarters somewhere where you may have a higher pay and more status, but you're not really doing what's meaningful and direct and consequential in terms of patient care, direct interaction with the nationals and so forth, which is really where you find the joy and the reward. And I think that the message here is really that it's really important for us not to get sort of sucked into, I need to rise up the hierarchy. But it's really important for us to know who we are, what we enjoy, and to make sure that that's what we insist on doing.
Yeah, exactly.
Well, Nana, thank you very much. It was great to chat. And, some of these things I never got to ask you anyway, so I learned new things too.
Thank you for the interview, and thank you for listening to me.
Thank you, Nana.
We hope you've enjoyed this latest episode of On Becoming a Healer. If you have, and you haven't already subscribed, please consider doing so now. Take care, everyone.